And I'm Morgan. I'm going to be your student nurse today. Can I go ahead and just get your full name and date of birth?
Annie Urea, born October 1st, 1980.
Okay. And is it okay if I call you Ann?
Yes.
Okay. Can I ask you what sex you were assigned at birth?
Female.
Okay. And what gender do you identify with?
Female.
Okay. I'm just going to begin by asking you a few questions. So you know your name, so I know you're oriented to yourself. Do you know where we're at today?
Yes, the hospital.
Okay. Do you know what day of the week it is?
It's a Thursday.
And do you know who the president is?
Joe Biden.
Okay, so I'd say alert and oriented times 4. So I'm now going to just be asking you some other questions about your health history. So do you have any allergies?
I do not.
Are you currently on any medications?
I have a Nexplanon implant in my arm.
Okay. Do you have any surgical history?
I had my gallbladder out earlier this year.
And so I'm assuming you're hospitalized for that?
Yep.
Okay. Do you have any past medical history?
Yes, I have frequent UTIs and seasonal allergies.
Okay. Do you have any family history?
です. My father has hypertension and my mother had breast cancer at the age of 60.
Okay. Do you smoke?
Never.
Do you do any illicit drugs?
Never.
Do you drink any alcohol?
I will occasionally have one glass of wine with dinner, but never more than one.
Okay. Do you feel safe at home?
I do. I have a wonderful husband and we have 2 beautiful kids.
Oh, that is great to hear. I'm now just going to begin to ask you what's brought you in today, Miss Ann?
I have pain when I go to the bathroom.
Okay, and when did that start?
This morning.
This morning, okay. Does anything make the pain better or worse?
I haven't noticed anything, but it's this really sharp pain only when I'm urinating.
Okay. Do you have any other precipitating factors or symptoms?
I took my temperature before I came in at home and it was 100.
Okay. So now I'm going to begin the assessment. So I'm just going to start with your pupils. So now if you look forward, I'm going to shine a light. Okay, and then the other eye. Pupils are reactive. Now I'm going to have you look at the top of this pin here. I'm going to bring it closer. And they accommodate as they should. I'm also just going to measure your pupil size. And I would give that a 4. I'm now just going to check your oral mucosa. So I'm going to look in your mouth, and that is pink and moist. Can I have you raise your eyebrows? Can I have you smile? Can I have you puff out your cheeks? Okay. So now I'm going to be moving down to your upper extremities. So I'm just going to move the blanket here. I'm checking in colors normal for ethnicity, using the dorsal side to check for temperature. And temperature is normal. I'm now going to be checking capillary refill. And that is less than 2 seconds bilaterally. And then I'm going to be doing skin trigger, so I'm pinching. And that is normal elasticity. I'm now going to be having you do finger grips, so just squeeze as tight as you can. Perfect. And then I'm going to be doing radial pulses bilaterally. And I would give that a +2 bilaterally. Okay, so now I'm going to be examining your lung and your heart sounds. And so I'm just going to be lowering your gown here. Okay. So I'm just checking here, colors normal for ethnicity. I don't see any abnormal pulsations or masses. I'm going to be palpating up here. Let me know if you have any tenderness. Does that feel okay? Okay. Now I'm going to be checking for thrills and heaves. Okay. And then I'm going to be palpating your apical pulse. Now I'm going to be listening to your lung sounds first, so take a deep breath at each site, please. With the diaphragm. Okay, now I'm going to be listening to your heart sounds with the diaphragm first and then the bell. So I'm going to be starting on the right second intercostal space. And then now with the bell. Okay. Now I am just also looking for symmetry, and she has a normal 2-to-1 symmetry here, and like I said, I don't see any abnormal pulsations or anything, and color is normal for ethnicity. I'm gonna have you sit up now, and I'm here again just checking for color, and color is normal. I'm gonna be palpating. Do you have any tenderness there?
Nope.
Okay. And then I'm checking for chest symmetry when breathing, so I would watch for the thumbs moving closer and further apart and symmetrical. I'm now going to be listening to your lung sounds with the diaphragm of my stethoscope. Okay, I'll lay you back down here. Now I'm going to be moving on to your abdomen, and so I'm going to lift your gown back down here for a second. So once again, I'm checking for any abnormal pulsations, any abnormal pushing out, anything like that, and I don't see anything. So now I'm going to listen to bowel sounds in all 4 quadrants. And bowel sounds are normal active in all 4 quadrants. I'm now going to be palpating for tenderness or masses. Does that feel okay? Anything hurt?
Nope, it doesn't hurt.
Okay, and when was your last bowel movement?
Last night.
Okay, lift your gown back up here. So now I'm going to be moving to your lower limbs here. So I'm just again checking for color appearance. I see no changes in color. Skin is normal to ethnicity, and then I'd be checking for edema in both legs. No edema noted. And then I'd be checking temperature. Both limbs. Temperature is also normal. Now you'll be checking cap refill. That is less than 2 seconds bilaterally. And then I'm also going to be checking the dorsalis pediis pulse. I would give that a +2 bilaterally. And then the posterior tibial. Once again, the +2 bilaterally. Then I'm gonna have you do foot pushes and pulls. Can you pull against or pull against my hands here?
Yep.
Can you push? Okay. And then I'm going to be testing your reflexes. So normally I would have the knees hanging, and I would hit right here bilaterally on both sides. And then I could also do the brachial reflex bilaterally by having hold this arm up and then feeling for this tendon here and hitting there on both sides bilaterally. That's all I have for you. Do you have any other questions, Anne?
No questions.
Okay.
Can I get some water though?
Yes, of course. Thank you.
Thank you.